Okay, Dr. James Sayul is my name. I'm a specialist in aviation medicine and public health, and I've been here for about close to 5 years now. We have, as Entebbe International Airport, we've been always working closely with the Ministry of Health, WHO and CDC and other partners to ensure that we protect the country from highly infectious diseases. And you recall that even before this outbreak of NCOV, that's novel coronavirus, we have been 24/7 screening for Ebola virus. There's been an outbreak in the Eastern Democratic Republic of Congo, and it is not yet it's not yet controlled up to now. And we have a team of over 16 staff that we work, 16 public health officers, 2 medical officers and myself, and we work in shift to make sure that we cover 24/7, to make sure that everybody coming into the country is screened for highly infectious disease. We use international health regulations and what you call CAPSCA guidelines and SOP, and which are approved by the Ministry of Health and WHO. So literally everybody who comes here, right from that side, that's where they enter the airport from. The thermoscan picks the temperature. We're also observing them according to the protocol of the particular disease. The thermoscan picks the temperature, which most of these highly infectious diseases presents with a fever. If you're talking about Ebola, we're talking about N coronavirus. Fever almost comes right from the onset. And in this case of coronavirus, somebody also has respiratory distress syndrome. You're having difficulty in breathing. You're having flu-like syndrome, kind of. You're running nose, you're sneezing, you're coughing, having difficulty in breathing, breathless. So we make that observation as the passengers are approaching, and the machine helps us to pick the temperature. So according to the protocol, if we get somebody with temperature above 37.4 degrees Celsius, we take you to that side of the health desk. We have site we're prepared where we have more interactions with you, question you, ask where you've come from, and we again check your temperature using a non-touch infrared thermometer. If your temperature remains high, we have a standby infectious disease ambulance. It's waiting. So I make a phone call. I myself or two of my medical officers are the ones who confirm the cases. The public health people, they don't even touch the suspect. After identifying the temperature and the symptoms, they put them aside and then call the doctor. Or if the doctor's around, then immediately we have confirm that this person probably is having an highly infectious disease. So we call the infectious disease ambulance. It parks right there, and we put on personal protection equipment, which we have it right here. We have enough supply, and we walk the person or roll the person to the ambulance. I will have already called the isolation unit, which is just here. It's a well-built place here at Entebbe by the Ministry of Health. I call them. There's a staff who are already trained, and that's their role to receive and manage this kind of patient or suspect. I also call the Virus Research Institute, which is just in Entebbe here. There's always somebody on call to come and take the blood of the suspect. So by the time the ambulance arrives there with the suspect, the person from UVRIS will arrive, draws the blood, and takes to analyze for this suspected highly infectious disease. And within, normally 48 hours or so, they bring the results. I must tell you that I also called the Public Health Emergency Operations Center at the Ministry of Health. I informed them that we have a suspect in presenting with this syndrome. Because from there, they take up the management. Our role stops when we hand over the suspect to the isolation unit, and we decontaminate ourselves, and we come back to the airport. Yep, thank you. Dr.
It's okay. Right now, no case of coronavirus infection has been reported here in Uganda. However, officials from ministry.
Uganda, we are prepared. And by the way, for your information, Uganda is one of the countries that has a very strong capacity in public health managing and public health emergencies. You have seen we have had many outbreaks of hemorrhagic fevers. Some of them are serious, some of them are mild. But Uganda as a country has managed it quite well. Ebola is just, for example, in our neighborhood, which is very porous. But we've managed to control it in a way that cases that come, we identify very fast, isolate, and it doesn't spread to the country. So as far as coronavirus is concerned, it has come at a time even when we have already been screening for Ebola, and we have the team in place, we have the support from the ministry and other partners, CDC and WHO, and we are able to just reorient ourselves. Last week when I got the case definition of coronavirus, I immediately orient the staff on that, and we literally train them to know that we have this additional, and we started screening. What we have not been putting on is the mask, but we have started putting on the mask because to avoid the droplets of somebody coming coughing all the way, Yeah. So and of course gloves and with the use of. As I said, we are not worried because we are ready to receive. When the cases come, we already have the case definition. And as I talk, when you arrive, there's a meeting going on at National Disease Task Force, and we're talking about the nitty-gritties on how to beef up our structure here. But otherwise, with Uganda, we are ready. Yeah. We have isolation, we have our staff who are trained, we are generating more resources to make sure that we have supplies like masks, sanitizers. We shouldn't worry. Let people go, because even China as a country, together with WHO and partners, they are also doing screening of those who are leaving China. Yeah, and the incubation period for N coronavirus has been so far being followed, known to be about between 2 and 10 days. So somebody is most likely to break down even before it comes to the airport. So in China, before it boards even the aircraft. Yeah. Us putting a mask, but we have already been doing screening here, and we have our clinic system which works quite well. When you get a suspect, immediately we cross-check to make sure that it's actually highly infectious disease. And we have the protocol, which I'll show you, even see them pinned, there, that we follow, and the SOP. So a suspect, we have got a suspect. We have infectious disease ambulance standing by at grade B. So I make a phone call for the ambulance to come. I make a phone call to isolation unit good enough. It's well built. It's here in Entebbe. It's only 10 minutes away for them to get ready to receive a suspect. And then I make a phone call to the virus research. There's always a standby lab person to come and draw the blood. And then I call public health emergency operation center at the Ministry of Health, inform them we have a suspect and is presenting with this and this and this. We are dispatching to the isolation unit, and we have already informed them virus research to come and take the blood. And this has been running on fairly well, and we have not had big issues with that.